or two, but the doctor actually requested for it. And so we thought that one of the little things she can understand, so that somebody like Afro girl and myself, if the full blood count result comes and then they push it back into your folder and they go to take it back, you're not working like they have taken stock of your whole life and you don't know what's happening. So just a little bit, not too technical, but for us to understand. And we're thinking that if you have first-hand idea of what's happening, which is a starting point, people will be encouraged to go to the hospital more. You know, it's not like some sort of death sentence. It's pretty simple. So this morning, we are joined by Dr. Louisa Ademiki Mate. Ademki Mate, maybe you should say the same name properly for me. Municipal Health Director, you find her at Ayawaso West. Good morning, Happy New Year.
Good morning.
I love your locks.
Thank you. Many happy returns to you.
Okay, I know that earlier before we went on, you were wondering, but these people, among all the health, topics that they could discuss, why would you want to focus so much on full blood count? And then I thought to want to give some clarity. But generally, what would be a full blood count?
Well, I think it's an interesting laboratory choice because it's quite common. Like you said, it's one of the first things we ask a lot of our clients to the labs that we ask our clients to do. And it's a blood test. So technically, when you visit a hospital, you are taken to see the doctor, you have a history taken, you have an examination done, and the next thing is your labs. And most of the time, most definitely, most likely, you would have a full blood count as one of them because it looks at the total picture of the blood. And when I say total picture of the blood, we know that the blood is made up of the liquid part of it and the cellular part of it. So the liquid is what makes it flow. And then the cellular parts are those nitty-gritty ingredients that make the function of the blood. So yes, taking it from there, like I said already, we have the plasma, which is the liquid part of the blood that makes the blood flow, and the cells, which are the red blood cells that give the blood its reddish color that we see, and then the white blood cells, which function as the soldiers, for want of a better word, to be a bit more down to earth on it. The immune system, markers of the immune system, white blood cells, they are the fighters, the soldiers of the blood. And then we have the platelets, whose function are to make sure that when you get a cut, you don't bleed out to death.
Right.
So these three major things, or let's say four, because the plasma, which is the liquid parts, the red blood cells, the white blood cells, and the platelets form the major parts of the blood. And with a full blood count, it gives you everything that you need to know about this blood, the contents of it, even how they are functioning. You can get all that from your full blood count.
Oh, right. And so do I have to always wait till I go to the hospital and the doctor wants to probe further, or this can be, because I'm curious, I want to know what's happening in my body, and then I go to the lab?
Well, in this day and age, I don't think we need to always wait to be unwell before we are curious about what's happening in our bodies. Because a full blood count, like I said, it's a total picture of your blood, how the blood is functioning. So I should, and I can get up today, go to see my doctor and say, you know what, can you just run some labs for me? Definitely we would include a full blood count. It will include other tests like looking at your function, your kidney function, your liver function, even your urine, So you could go to your doctor and ask your doctor to request these labs for you as a screening test. And I always encourage people as a public health person that we need to be interested in what is going on in our bodies. You don't have to get sick before you find out, and then you find out when you're sick and it's probably too late.
Okay.
So the thing though is that because it's so technical, you just can't walk into the lab and say, I want it, because if you are given, the lab gets it done and gives it to you, you won't be able to interpret it.
Okay.
So you would need an expert, or at least a doctor or a nurse, to be able to interpret your full blood count, at least the basic level that makes sense. Otherwise, you spend money and you can't interpret it.
Okay. Yes. Just my curious self, I would have thought that if you did a full blood count, what else is It's just a full.
Well, in Ghana, we call it a full blood count. In other countries, you hear the complete blood count and things like that. So in Ghana, it's a full blood count, we call it.
Okay, the typical ones that I may have seen from some labs, maybe some celebrated labs, you would see the name on the left, you would see something. The interpretation of it gives you a fair idea that there are parameters.
Yes.
So if you went beyond it, it gives you an idea, except you don't know how much or what is happening in the body. But let's take the common ones that you have mentioned, the WC. What's the role of the white blood cells in your body anyway?
Right. So like you said, the full blood count is a panel. So it gives you a list of your blood cells. Also, so I think the commonest thing that you can find on your full blood count of interest to a lot of us is your HB, which is your hemoglobin levels.
Okay.
So something like that, you can easily look at it because most labs will give you a reference range. You know, so you take your panel, you have your HB, which is your hemoglobin level, and it gives you a range of the expected for, say, females and for males, you know. So it's different, slightly different from each lab because of the equipment that they use. Okay. But then it's standardized for the body.
Right.
So you take a lab, you take your full blood count, you probably find your HB, and it would be stated, a range would be stated for, females and stated for males. Okay. Your HB, which is your hemoglobin, looks at the oxygen carrying capacity of your blood.
Look at that.
So that tells you how much your blood is able to carry oxygen from your lungs to the whole of your body, because we thrive on oxygen. So if your HB per the reference range is low, then you know that the oxygen carrying capacity of your blood is reduced. And that's what we usually call anemia.
Okay. Yes,
that is it. Yeah, that is the commonest, marker. Okay. Your HB. Okay. It tells you about how much blood you're supposed to have, and per the reference range stated on your full blood count, what you actually do have. And then those are the things that would, I'm anemic. What are some of the things that could be the reasons why I'm anemic? Is it that I've lost blood? Because people experience trauma in accidents, they lose a lot of blood. So you test their full blood count and the blood would have gone down. Or for women, maybe a lot of bleeding from menstruation, common things like menstruation, or other common things like poor nutrition, not eating well. Anemia in itself is not a disease. There's definitely something that is causing it.
Okay.
So you see that you need to consult a doctor who will tell you, let's look at why your HB is low. Let's find it, the reason why, and then address it.
Okay.
You know, so that's one of the common interesting things you find on your full blood count.
Okay.
Then you ask about the WBCs. The WBCs are white blood cells. Their job in our body is to fight infection. And they are different. It's like being in a family. So you have the different siblings, and there are about 5 of them, major 5 of them. We have the neutrophils that fight more bacterial infections. Okay. And then we have the lymphocytes, which fight more viral infections. We have the eosinophils, who come up when you have allergies. So I see your panel, and I can tell, oh, your neutrophils are a little high, or your lymphocytes are high, or your eosinophils are high. Depending on the history and the examination I have from you, I can tell, okay. So like you said, they look at it and they say you have an infection.
Yes.
How do they know? Because they asked you a few questions.
Yes.
You said, gave them a few answers. They did a panel, and the panel is pointing to, yeah, probably this woman has an infection. But what kind of infection?
Okay.
Is it a bacterial infection? Is it a viral infection? Taking back to COVID, you do a COVID panel, you do a COVID test, it's positive, you get a full blood count, and most likely the marker of your white blood cell that is going to be high is the lymphocytes, because those ones are the ones that come up when we have viruses and they are charged to, fight it. So depending on what you're seeing in the full blood count and the history and the examination you have, you can make a decision that, okay, this is viral, so let's treat it this way. This is bacterial, let me give an antibiotic. This is an allergic matter, let me give something else because it's allergic. It's not totally an infection, you know. And then the red blood cells, okay, we've talked about the HB.
Yes,
Yes.
I wanted to find out, are they the same, the HB and then the red blood cells? Are they sisters? Are they?
Okay, yes. So they go together. I mean, if you see on the panel, you probably see HB, which is your hemoglobin. You will see HCT, which is your hematocrit. So your HB, like I said, is looking at the concentration of the red blood cells that you have. The hematocrit looks at the volume
Blood that you
of the
have.
yes, and all that talks about the quality really of your blood, because if you take the blood, you're expecting that about, like I said, 60 or 70% is liquid, which is plasma. Then you're expected to have about 30% of it being your hematocrit, which carries your oxygen. You know, so if you have too little of it, which is your anemia, then you have issues. You don't have a good carrying capacity, and especially with young adults, especially girls, if you have low HBs, it affects their school, how they perform, how they concentrate in school. So we pay attention a lot to these things. And then in the Ghana Health Service currently, we have that program that we call the Girls Iron Folate Therapy Supplementation, tablet supplementation, gifts, it's called gifts, Girls Iron Folate Tablet Supplementation.
Okay.
Which we have realized that because of low HBs in some young girls, they are not able to perform so well in school because the oxygen carrying capacity to their whole body, to the brain, is low. So we supplement them with iron tablets to boost up their HBs.
What's causing it? Is this what they're eating, or this is a genetic situation?
Yeah, so like I said, anemia in itself is not a disease. It's a, for want of a better word, like a symptom of something that is happening. So if you see someone with anemia, question is, what is happening? Why is this person anemic? So we take a history. That's what doctors do. We take a history, we examine you, and then we find out, okay, is it that your nutrition is poor? And we know that most young girls, most teenagers are menstruating, newly at it, growth spurts. A lot of the girls, I want to keep my body, I don't want to look big.
That is true.
Yeah, so
Big.
teenagers are not eating right. And for
Okay.
those who are eating as well, some may not be eating right. Again, you talk about taking a lot of fizzy drinks, not eating the right things and all those things. So, yes, we would find out what is the cause of the anemia, and then we would advise as to how to improve the anemia.
The anemia, okay, okay.
Yes, so that's about the red blood cells.
The
And then I think
platelets.
the platelets, which is the last bit of the cells in the blood, is responsible for clotting. That's its major responsibility. It helps us to not bleed out. I always say, without your platelets, you get a cat in your kitchen, you probably bleed out, you know. So that's the function of the platelets. It must be a certain number in the blood, about 150,000 to about 40,000. So we see those references in your panel. And if it's too low, then we know that, look, I mean, she's probably bleeding from this accident so much because her platelets are low. And then you hear things like, let's transfuse platelets. Because somebody is platelets, full blood count is showing that the platelets are low. And there's evidence from the history and examination that this person is bleeding out. So what do? You do something to correct the anomaly that you're seeing in the human being, and which is being confirmed by the panel that is in front of you, which is in your full blood count. So technically, I mean, that's what the full blood count.
So this platelets, does it also look red? If you're transfusing it, are you collecting it from somebody who's donated blood, or this is artificially formed?
No, they are also, so you do a blood donation, and then I mean, there's a technique that separates the content of the blood.
Okay.
So you see blood in the hospital, and you may not be so, you cannot say, I mean, as a layperson, I can, if I see a blood sample in a bag, I can tell, oh, this is plasma, or like this whole blood, this is packed cells, which is just the more of the cells done with the plasma. Because, of course, depending on what is happening, you just can't give any kind of blood product to a person. The person needs platelets. what business, and probably has the HB is okay, then you give a whole blood, you're increasing other components of the blood that the person's blood is fine with. And that would also give us problems because, you know, there's a reference range. If it's too much, it's a problem. If it's too little, it's a problem. It just needs to be
in a certain range. My goodness.
So, yes. So, depending on what you need,
okay.
we offer
I
that.
know that this may be just a little too much, but at what point will a doctor look at your full blood count and start to, you know, suspect something cancerous and say, you know what, we need to go a little further? And when they say we need to go a little further, where are they going? I see them going into your bone, and then they say bone marrow aspirates and all of that.
Right.
But at what point, what's the thing that will get a doctor saying, okay?
Right. First thing is that blood is produced in the bone marrow.
Okay.
That is the source of the blood. So if you find something wrong with the blood, you go to the source, you know. So yes, you mentioned bone marrow aspirates and things like that, but like that is, most of the time, that is like a bit high end,
okay.
like in areas of malignancy and cancers and whatnot. But then the red blood cells, the white blood cells, the platelets, as I said, all have ranges. So you see a panel, a white blood cell, and then you have like high numbers of lymphocytes. The lymphocytes we talked about are the ones that fight T viruses. And you expect a certain range for just a viral infection. And then you have like extremely high levels of lymphocytes, which we call in medical parlance lymphocytosis, like it's, yeah, like a lot. And or you have situations where the lymphocytes are like really few because the person has an infection. You're expecting that the person should mount a sort of an attack. And then, like, where are the soldiers? The soldiers are all gone. So is there something going on in the marrow that is not helping these the
soldiers to fight
or to produce themselves enough to fight? And so you see things like that. And there are, like I said, there are so many differentials. We call them differentials. There's so many reasons why a person would have such high levels of maybe a white blood cells or have too little. And again, we go back to our history. We always treat, like I say for doctors, we treat people, not labs.
Okay.
We treat the person sitting in front of you and not what the lab is saying. Okay. So before you make a decision on could it be cancer or malignancy or just an infection, you need to have spoken with that patient. You need to have taken a good history. You need to have had a conversation with the patient. What are the symptoms and signs of likely a malignancy? Because, I mean, commonly if somebody is having a malignancy or cancer, maybe weight loss, fever that is unexplained, you know. So you take a history, you also examine this patient, and then you look at the panel, and then with the panel you can say, this is likely to be a malignancy. Let's look at other things. Let's look at the bone marrow. And you know, most of our full blood counters are done by automated machines.
Okay.
So you put the blood in a machine, and the machine just generates all that. But in the case where you see a panel that is looking all weird, you want to actually, that's why we have hematologists.
Right. And
whose specialty are to look at the blood. They take your blood, they put it in a film, they look at it under a microscope, and there are certain ways that blood is supposed to be a certain shape, supposed to be a certain size, you know. It's supposed to look a certain way.
Right.
And then they look under the microscope, and your cells look, off. And then, yes, they can look at the history, the examination, and what your panel is saying, and what they are looking at to say, no, we are probably having a malignancy of the white blood cell, you know, that sort of thing. And there are so many things, like simple things, maybe not so simple, but say sickle cell disease.
Yeah.
It's not a malignancy, but it's an abnormality of the blood. And you can see that under the microscope, how the shapes of the blood samples are sickle, versus maybe a malignancy where the cells may look different.
Okay.
So we go through a lot of processes to decide whether there's a malignancy or it's a genetic problem or it's just
just
a
a regular
blood.
thing.
Yes, it's just a
Okay,
blood
two
problem.
questions. If the source of the blood is in the marrow, where in most cases one would go, then why do people say that udiwe albinya moja? Because then it's going into my body, it's not coming from my marrow then. Because it should come from my marrow. So why do you start, they start to refer you to dietitian? What's that role? What's that thing doing? Knowing that that's not the source where blood really is coming from. My understanding is that it's coming from somewhere in the body. That's question number one. I've also heard a term called blood culture. What's that?
Right. Okay, so let me start with the first one. Yes. So like I said, we are what we eat.
Okay.
I mean, human beings are what we eat, what we do, and all that. But mainly what we eat, what we consume. And we know that nutrition plays a huge role in how we look, even our function. Yes, the blood is produced in the bone marrow, but the bone marrow is nourished.
Okay.
How does the bone marrow get its nourishment so that it can function the way it's supposed to function? Our bones grow. I mean, when little ones are born, the bones grow because of what they eat.
That's true.
You need vitamin D, you need minerals, you need all that, and it's all in our nutrition. If your nutrition is poor, your bone marrow will be poor, and the function of the bone marrow will not be achieved. So yes, what we eat develops all aspects of our body, including the bone marrow that will eventually be the function of building that blood for us. So that explains that part. I hope it does.
Yes.
Right. And then the culture. So culture more. So saying culture is more like, okay, let's look at it as going into the farm and growing something. That's what a culture is about. It's like growing something. So I see your blood panel and I see, we have high neutrophils, which, like I said, neutrophils are more markers of bacteria. Or I have high lymphocytes, markers of viral disease. If I want to know which bacteria or which virus is the problem, I need to culture it. Technically, take it to a nursery.
Harvest it.
Yes, take it to a nursery. Give it an optimal situation or condition to grow whatever is inside of it.
Okay.
So it grows it, and you're like, oh, you see, that's a neutrophil right there.
Okay.
And this is the kind of neutrophil that is there.
Okay.
And so I can choose a more specific antibiotic to target that particular neutrophil.
Okay.
And not do what we call mostly empirical management. For instance, I mean, you see a patient at the OPD having maybe a regular UTI.
Okay.
So urinary tract infection, and then you say, okay, let's treat it empirically. Commonly, we use ciprofloxacin, we treat it. You expect it to go. And then 7 days later,
it's back.
Patient, yeah. So probably the empirical one didn't pick that particular one. It's probably a different or a more uncommon bacteria that is causing the problem. So now you would want to know. So actually, if you see a UTI, you would want to go a step further, culture the urine, and know specifically which bacteria is the problem, and then use the right antibiotics to begin with, because you're already saddled with, antibiotics resistance. We're just dishing out antibiotics, not targeted for the bacteria mutates, and the next time you need it, you need an antibiotic, there's no response.
Okay.
So why don't you culture? That's what we mean by culture. Take the sample, grow the thing, know which one is the problem and which antibiotic is targeted towards dealing with it. And that is it.
I've been totally confused, because then it is not until you have done a full blood count that the person says that, the doctor says, okay, now we need to do a blood culture. Then I say, okay, what's going on here? So thank you for that clarity.
You're welcome.
Let's just go a little bit off the full blood count. If a person is pregnant, I know that, maybe I may be wrong, I know that they ask you to do a urine test. But at what point is a doctor going to ask you to do a blood test to see if you're pregnant or not? What are they looking on the parameters? What will they look at?
Well, you see, the a blood test to see if you're pregnant.
Pregnant,
Oh no,
yes.
no, it's there. We do blood tests to tell whether you're pregnant or not. You know,
Okay.
but it's not very. It's not the go-to, or it's not a common thing. The thing is, I mean, everything that happens to us mostly shows a bit earlier in the blood. You know, most of the time, we ladies would go for a urine stick. I mean, in the pharmacy, and then get into your washroom and like, yay, I'm pregnant. Or oh my God, what's happening here? You know,
Yes.
but yeah, but that before it gets into the urine, it would have been in the blood way earlier.
Okay.
So you could use a blood test way earlier before you even miss the period to pick up ACT in your blood, you know.
Okay.
So yes, we use that, but it's not like common stay. I mean,
Okay.
sometimes we go to that when we have other issues with pregnancy and we want to monitor how that hormone is behaving. So more of a monitoring thing for other bigger conditions than just pregnancy related.
Okay. Okay. Let's stay around women a bit. If a woman is in their period and then they're bleeding so much, in my young self, the explanation that my teacher in school said to me is that, oh, it's just egg that's not fertilized, and so it's blood that your body doesn't need that is coming out. They will tell you that, okay, this blood is spoiled. It's not supposed to be there. It's supposed to come out. So in that case, first of all, I want you to confirm if that's true or not. But in that case, are you losing blood? If I was in my period and I bleed a lot, and for some reason you go, two things in my question, you go to the hospital and you do something else is happening to you, you do a full blood count. The doctor will say, I see a lot of blood. Are you in your period? What did they see? That's one. And then number two, if you're also bleeding too much, are you genuinely losing blood, or it's just what is supposed to go out of you that's going out?
Right. So there's when it comes to menstruation, there's a normal menstrual flow,
Okay.
and then there's an abnormal menstrual flow, which could be too much or too little. You know, so the body has its, I mean, size. So are you bleeding too much, or you're even bleeding too little as per the expectations? Now, how do we get the menses? So the lady produces what do you call the eggs, and the eggs are expected to be fertilized, and then you have a baby. In the situation where the eggs are produced but they are not fertilized, still the uterus, which is the womb, preps itself to receive that baby.
Okay.
So it's excited. I have an egg here. It's probably going to be fertilized. Let me prepare my home to receive a baby. And then, oops, no egg is fertilized. Egg is produced. So what we see as menstruation is the disappointed lining of that uterus in reception for the baby. So yes, it's lined itself, and it's blood cells that is used to line itself. So yes, they all crumble down. You get what I mean?
Yes.
So it crumbles down, and then it comes out. Ordinarily, people menstruate between 3 days and 7 days. And every lady knows the number of parts that you use. So maybe in a day, some would change once or twice, morning, afternoonish. Some would do 3 times. I mean, and it starts right out from menarche, where we start menstruating. So people know how they, and then somewhere along the line, you are going 2 weeks, and the blood is not stopping. That is abnormal. That is bleeding excessively.
Okay.
Because for you, that is not the expected. And we know that usually it's between 3 days to 7 days anyway.
Yes.
So why are you bleeding for
Right.
weeks? And then so it takes us back to the Bible issues of the woman with the blood.
Yes.
You know, so yeah, she's not supposed to, that's not the normal. you know, so why is she bleeding like that? And yes, you are losing blood because it's actually blood that you're losing.
Okay.
So you could overbleed and lose blood and become anemic from losing blood so much. And again, those things are, want of a better word, symptoms. So why is she bleeding so much? Somebody would have to take a history, somebody would have to examine you, somebody would have to ask for labs, and then decide that this is the reason why she's bleeding so much, and then find a corrective measure for it.
Okay.
You know, so yes, when we menstruate, we lose blood, and it is blood that is expected to be lost because something didn't happen. And yes, but once it becomes too much, then it's a problem. I think you asked something else about. Oh, there was another question.
I have even forgotten.
Yeah,
I'm just throwing questions at you.
Yeah.
But so good morning, the AM Club at MS24. Unlike Dr. Louisa Adamki-Mate, she just made medicine very easy from her explanation, and I'm enjoying the show. You also asked a few other questions which are quite personal, so we'll send the responses to you a bit later. You're watching us from Techiman Chukwubuka. Thank you so much. Thank you so much. You're doing so great, Doctor. I totally understand a lot now. Okay. Okay, if you don't add your name, I won't be able to tell Doctor how much you love her. But in wrapping, full blood counts, a doctor can ask for it as many times as the doctor wants, right? It's not alarming. It's not something to be afraid of.
No. Like I said, we treat our patients. Yes. So if there's a reason why they're asking for it, then of course they need to ask for it. And also, I mean, if you found something wrong in the blood, you would need the blood again to tell whether it's getting better.
Okay.
So you can also keep requesting for it as a monitoring tool.
Right.
Because you had a baseline. This was the issue. You need to be sure that the problem is solved. So you can ask for it intermittently to be sure that the problem is solved. If I say there's infection in the blood and I saw high neutrophils, I gave antibiotics. I expect that after the course of the antibiotics, the neutrophils should go back to their reference range. Okay. How do I know? I would just have to request for another one, and then look at the panel and say, oh, look at this and look at that. We have a solved problem, or it's probably getting worse. What do we do? So yes, depending on the situation, they can ask for it as many times as is needed.
Okay, is it expensive to do? I know you're not the one at the lab, but just maybe.
Oh, well, I think anything between 35 CDs, and depending on where you do it. Okay. Depending on where you do it, but I think 35 CDs in a government facility should get you a full blood count. And we know that NHIS also covers some of these labs. Okay. So depending on where you do it, you probably will not pay even anything for it. So
Okay. Thank you so much for making time out of your busy schedule. I'll just give you a minute to wish your municipal health area a happy new year and any message you have for them.
Right. Oh, thank you for the opportunity. Yes, this is Ayawaso West, and you know, we span Legon, Joulu, Abilinkpi, Roman Ridge, and yeah. So I have loved working here. I think the people of Ayawaso West are very receptive for issues concerning health, and I wish for more collaboration, and just wish everybody a happy new year. And people should pay attention to their health. It's important. Eat well, exercise, and get some more sleep.
Thank you. You're so pleasant to talk to.
Thank you.
We've been talking to Dr. Louisa Adamki-Mate. Did I get the surname right?
Mate.
Mate.
Yes.
Okay, but that Demki, which I thought was so difficult, I got right.
Yes, it's fine.
Okay. Okay. Thank you, guys. Your messages are coming quite late, and when she has time, another time, we'll bring her so that she'd try and answer all of your questions. Thank you so much. Lifestyle Daily. Dan, you have a fair idea of what the full blood count is. Let's move on to Throwback Thursday and a lot more. We'll plug you on onto the show. There's so much on the show. Do stay.